Okay, I have my ice water for my ice bath. This is 49 degrees. That's pretty cold. Apparently, this is just 1 degree colder than what it has to be. It needs to be around 50 to 59 degrees, so this is fine. Let's roll down this neck. Okay, let's go do skincare. Do I feel any better? You know what? It is kind of a nice, refreshing feeling. Okay, I have actually filmed this video. This would be my 3rd time, and I've not been able to post it because I hate how my acne looks. And I always seem to film this when I have a brand new breakout, which I do. So in order for me to actually make this out and get the message that I want across, which is I want to talk about the prescription products that we are given, what I've learned about them, and some warnings that I just didn't know that I want to make sure that I share. So I am just gonna go quiet and go through my skincare and makeup, and once I'm done with that, I'll come back and share a little bit more about my skin. So enjoy this music montage. Okay, time for makeup. I genuinely try not to wear makeup on my face on a day that I am home. I just want to let my skin breathe as much as humanly possible. But if I am going to go out even to run an errand, or if I am filming, then this is the makeup routine that I do. It's not the same as if I were going to go out to an event. So I've been using this as my face base. It is the Rare Beauty Tinted Moisturizer with 20 Spectrum SPF. I did already put sunscreen on, but hey. My very best friend in the world is my concealer, and I can't wait for the day that this doesn't have to be my friend. Okay, that's it for my makeup. Now that I'm ready to be in front of the camera, I primarily want to share with you 3 things. Things that I've learned about acne, things that I've learned about prescriptions that treat acne, and then serious questions it makes me have, and maybe some explorations that I'm curious about. Let's start with number 1. I have now seen, I don't know, 4 or 5 doctors and dermatologists from different kinds of healthcare providers. Anthem, Blue Cross Blue Shield, Kaiser. And a lot of them have told me something that was very demoralizing, that acne is largely genetic. It seems to me that study after study show a lot of correlations, things that might cause acne, but not something that is very definitive. That was really disappointing to hear that it was genetic, but when I do look at my family, nobody else seems to really suffer with acne. And then the other things that I was learning is the health of your gut and how your gut can affect your skin, how the health of your brain can affect your skin. So stressors, poor diet, can really show up on your skin is a big research topic right now that I've been looking into. Again, it seems like there's a lot of ongoing research. Nothing is like very proven definitive causal, but a lot of things point in that direction, which is why I think so many of my doctors have said we can really just say that acne is genetics and everything else is being researched. So that is the world of acne in a nutshell that I've now been learning about for 3 years. So with that, I want to get into my second topic, which is really the meat of what I want to talk about, and it's the prescriptions that are given out to treat acne. And they're given out with the best intention of treating acne, but there are a lot of side effects that I don't think are talked about enough. Some pretty extreme side effects in very common acne medications. So the first one I really want to talk about is spironolactone. I was on spironolactone for 2 years and it did work. I decided to get off spironolactone, as I have a whole video about this, because I fainted. I basically realized I have really low blood pressure, and spironolactone is a drug that is used to decrease your blood pressure for people who have high blood pressure, Well, I already have low blood pressure, so spironolactone was causing my blood pressure to be depressed even more, and the risk to that is fainting. So it's not like this terrible medical thing that could happen, but if you faint and you hit your head, that's the main concern. And I did actually fall in the parking lot of Whole Foods, and luckily my husband caught me. So since that moment, my doctor's like, gotta get off spironolactone, figure something else out for your skin. And since then, my acne has really come back. I recently went back to my primary care physician and I said, hey, listen, I'm really not happy with my skin and I'm going to ask my dermatologist to put me back on spironolactone. Can you please give me the okay? My primary care physician is okay with me going back on this medication. And she said, no. She basically was like, this drug is used a lot, and a very little known side effect is that if at all you want to have children, specifically within the next 2 years, then she would not recommend me going on spironolactone for acne because it can cause birth defects. So I think this is pretty well known for Accutane. I did not know this was the case for spironolactone. Her professional opinion was the window of safety is 2 years for it to totally be out of your system, and that is the window of time that I have with my husband to start a family. So I'm well within that window where spironolactone is probably not the best idea. In the last 2 years that I've been on this drug, not a dermatologist has mentioned that specifically. And maybe it was on me to say, hey, I plan to have kids in X amount of time, but I wasn't thinking about kids then. And I'm a little bit surprised that the dermatologist didn't share that information. So I wanted to broadcast that as much as I can. Again, this is information from my primary care physician, and I just wanted to share something that I learned. There went my idea to go back on spironolactone to help calm down this acne that seems to be coming back. The last thing I wanted to say within like the second topic of prescriptions that I've become aware of is really Accutane. My dermatologist in December basically told me, hey, listen, spironolactone is a no. You've already done doxycycline antibiotics. You've already tried retinol and Winlevi, and you still want clear skin. And I'm like, yes, I do still want clear skin. She said, okay, then your last resort is Accutane. And she made me sign some waivers. I was read all of the terms, and I won't lie, when I signed the paper, I was a little bit hesitant because of everything that I read on the side effects. So if you don't know what the side effects of Accutane are, I do want to share them with you. I'm going to categorize them in 2 buckets. The first bucket being the less severe, more common side effects, which are in the world of really, really, really sensitive dry skin, which can result in, for the most part, I think 99.99% of the people experience this, peeling and extreme dryness, also sensitivity to the sun, and apparently nosebleeds. So it's not just drying your skin, it is drying the insides, and a lot of people experience nosebleeds. I didn't know about nosebleeds, but they are more common than what I had thought, given that I didn't know about them. Imagine just getting nosebleeds. That feels like a lot to me. Like, I'm taking this drug and as a result I get nosebleeds. And this is all in the category of like less severe. Onto the category of more severe, and this is the stuff that made me say, no, I don't want to take this drug. Number 1, if you have any kind of mental illness, which I do have, anxiety and depression, I don't know why that's so hard to say, or if there is any mental illness in your family, then this drug can trigger it and make your mental illness worse. At the extreme end of that, there is some correlation, not causation, that is proven, but correlation with suicide. So it can make your symptoms and your expression of depression, anxiety, stress so severe that some people have ended their lives. And basically what it says on the pamphlet that they give you is, we don't know if these people that have committed suicide would have done it with or without the drug. That's why it is a correlation, not causation, but the warning has to be had. And if I'm taking a drug and that's the kind of warning that it's telling me, I don't know, something tells me to stay away. And then last in this category of severe consequences and side effects to Accutane is that this medicine is known to cause birth defects. So it is heavily regulated. I mean, you need to take a pregnancy test every single month, at a lab through like blood draw to prove that you are not pregnant, or else you cannot be on this medicine. You need to meet with your dermatologist every month as well to make sure that you are taking it as indicated, that you are using at least 2 methods of protection so that you do not end up pregnant. So on the plus side, I'm glad that some sort of regulation body is making sure that a bunch of babies aren't born with birth defects, because nobody wants that. But also, I don't really love the thought of yet another regulatory body being so into my life. Given that Luke and I, my husband, really do want to have kids in our lives, like this is something that we know we want, and given that I also don't know how long Accutane would take to get out of my system, it basically was a big no for me. And I just wanted to share all of that in case you didn't know, in case for any reason this isn't being disclosed to you, because there's something that I've learned in the last 2 to 3 years in this acne journey, is that knowledge is splotchy. Some doctors seem to know one thing, some doctors seem to know another. All of these doctors, very well educated, they have their accolades of top universities. Basically, we're just dealing with the information that we have, and the best that we can do is spread and share said information. That is the end of my little podium speech on these are all the side consequences or side effects of these medicines that aren't really being shared as much as I think they should be, because I didn't know about them as much. Okay, and then my last and very quick category is all of the things that it makes me question and think. I've already shared one, which is the gut, brain, skin theory, which basically is what I shared before. What you eat and how stressed you are affects the health of your skin. So I've started to take a probiotic to get my gut as healthy as possible. I have also changed over to be 99% plant-based. I have basically eliminated all dairy, all animal products. I have also eliminated alcohol. The one thing that is hard to eliminate for me is sugar, because I do love baking. Just really trying to eat as healthy as humanly possible and see if that gets reflected on my skin. The last thing I wanted to share, which is really curious, is I've noticed an increase in acne as well, with increased physical exercise. So I have been working out very consistently. I feel so happy that I am disciplined, but I have seen acne creep up in places that it wasn't before. Like, for example, my neck. A little bit on my back, and sometimes on my chest. And there is definitely a correlation. If I work out, then I get acne. I decreased the amount of cardio I was doing, I increased the amount of weights I was doing, and I was sweating less while still exercising. So I also wonder if there's a little bit to do with less cardio, more strength training to help with acne. I don't even know if anybody's, I'm sure somebody has thought about it. I'm sure there's a research paper on that. I need to find it. But yeah, I'm also thinking about not just what I eat, not being stressed, I am meditating, but also the kind of physical exercise that I do. So as you can see, my life is revolved around healing my skin. You can call it a bit of an obsession. I want clear skin. I want my outerness to reflect all of the effort that I put into my body. Anyway, that's where I am now. I am on this ongoing journey with acne, and if you have seen my previous videos, then thank you, I appreciate it. Thank you for watching this one, and I'm gonna keep you updated because this is just my life. It really is such a central point of who I am now, because I have made everything in my life about improving my skin health. Until next time, thank you for watching. Have a great day.